All right, nurses in our area are going above and beyond. Not only are they helping save lives during this pandemic, they're often the only line of communication between critically ill patients and their loved ones. Fox 23 Morning Anchor Michelle Lynn talked with a Tulsa woman doing all she can now to thank the people who saved her mom's life.
Just a few days ago, Jessica O'Mealy wasn't sure if her mother was going to survive.
She's suffering alone in the hospital, and there was nothing we could do. We couldn't be there.
She says her 60-year-old mom, Kay Wooten, thought she had a sinus infection over spring break. She was exhausted and had no appetite for about a week. Then she developed a bad cough. She still wasn't running a fever, but on Tuesday, March 31st, she asked her husband to take her to the hospital in Stillwell.
He couldn't go in with her, so he sat in the parking lot the majority of the day.
Doctors diagnosed her with bilateral pneumonia. They suspected COVID-19 and rushed her to St. Francis Hospital here in Tulsa by ambulance.
We loaded up. We have 3 young boys. We all loaded up, drove to St. Francis, just hoping to get a glimpse of her as they wheeled her in.
The test confirmed she had coronavirus. The first few days in the hospital, Kay was on oxygen and she was struggling.
The pneumonia had affected her lungs so much that she could barely even speak. So it was really, really hard. I still can't wrap my mind around it.
Then at 4:30 a.m. on Saturday, April 4th, her mom sent a text.
She said, "I'm going on the vent, and I want to tell you all that I love you, and to tell my grandkids I love them to the moon and back, and tell my daddy I love him too." I think the hardest part was knowing that that could be the last line of communication we would ever have from her. We had no idea where this would go, and it was a pretty emotional day for us.
3 times she seemed to be ready, and doctors tried to take her off the vent, but each time her condition quickly worsened. Kay spent 13 days on a ventilator. Through it all, her family relied on nurses for updates.
We all kind of developed a routine of who would call when so that we wouldn't overwhelm the staff, but that we could get updates. The verse that was basically our anthem the whole time was Exodus 14:14. "The Lord will fight for you. You need only to be still." And that was so perfect for us because that's all we could do was be still and pray and just trust him with her life. I think about these, nurses that are going in every day. Basically, that floor at St. Francis is basically an ICU floor for COVID patients. So I know it's stressful. It has to be so hard. And we wanted to do whatever we could to support them, to pray for their protection, to pray for their families and their protection, to pray that these nurses would have the strength they need to do this job every day and step in and take the place of family because we can't be there.
Last week, she posted this update. Today was so very long and hard. Each time she shares news about her mom, she asks her Facebook friends to pray for the healthcare staff by name.
A lot of our friends on Facebook have taken very seriously and are praying over these nurses name by name by name.
No one is allowed to be there to comfort her mother or advocate for her, and those nurses have stepped in to act as family, including one they call an angel.
Karen sat and sang Amazing Grace to her. She told us in one of her text messages that when she closes her eyes, she just hears Karen singing to her, and that helps her sleep. It means so much more to pray for a name.
The best update of all, this post Tuesday afternoon, less than a week after her family thought they might lose Kay, doctors released her from the hospital. Covering news that matters, Michelle Lynn, Fox